Hey everybody, and welcome to another video here at Whiteboard Doctor. Thanks for checking it out. Happy Monday. Hope the weekend treated you well. Today's topic is one that was actually requested by one of our Whiteboard Doctor Patreon members, and that is ways that we can help control high blood pressure without medications. So we're going to talk a little bit about what high blood pressure or hypertension is, how many people it affects, what the symptoms are, and how to identify it and who should be getting screened for it. And then we're going to dive into ways in which you can help try to control high blood pressure without taking medications. This is a spinoff. We did a video years ago when the channel was pretty new on high blood pressure. This is a screenshot from it. Very, very chaotic. But we will link it in the video description. It's high blood pressure explained. Understand this very common disease, which is a kind of funny throwback to a handful of years ago. With no further ado, we're going to take a 30-second break for the introduction, but don't go anywhere. We'll dive right into the topic after. Hello, everyone, and welcome to another video here at Whiteboard Doctor. Thanks for joining us today. Here at Whiteboard Doctor, our mission is to provide you with free, interesting, relevant, understandable medical education and news for all types of lifelong learners, trainees, and practitioners. We have weekly videos that we debut Fridays at 5 p.m. Eastern Time with bonus medical education videos posted throughout the week. We'd love for you to join the Whiteboard Doctor community and follow along by hitting the subscribe button located in the bottom right-hand corner. We also encourage all likes and comments, even if it is just to say hello. All our video descriptions contain links for additional related videos that might be interesting, so don't forget to check those out. And lastly, a quick disclaimer, none of these videos are intended to be acted upon as medical advice. Please pause the video here and read this disclaimer in its entirety before moving on. With no further ado, stay well, keep learning, and let's get to the video. All right, thanks for sticking around. So 5 things that can help control high blood pressure without medications. Again, requested by one of our Whiteboard Doctor Patreon members. Anyone interested in joining our Patreon community, we'd love to have you. We'll link it in the video description. Definitely check it out if interested. As for hypertension or high blood pressure, hypertension actually affects a ton of people. An estimated 80 million people in the USA. I'm sure some people watching this have hypertension, and almost a billion people worldwide. So a ton of people have high blood pressure, which is also called diagnostically hypertension, and it's abbreviated HTN. So high blood pressure hypertension. It actually affects men and women similarly. There's this notion that men are more likely to have high blood pressure, but that's actually not the case when you look at the overall lifetime risk of both of those things. Now, younger folks, men are more likely to have hypertension, so young men are more likely to have it, but actually older women are more likely to have it, and that evens out over a lifetime so that men and women have a similar incidence of high blood pressure hypertension. The lifetime risk of developing high blood pressure, we thought this stat was really striking. The lifetime risk of developing high blood pressure in those over 55 years old is actually 90%. So if you're over 55 years old, you don't have high blood pressure, you have a 90% chance of getting or developing high blood pressure in your lifetime. And that's a huge number. 9 out of 10 people who don't have it, when they grow old, will develop it. And the 5 things we're going to talk about can actually also help those who are high risk for developing high blood pressure avoid developing it. And it actually costs the healthcare system $47.5 billion per year in the USA. This is for hospitalizations related to high blood pressure, medication costs, etc., etc. When it comes to high blood pressure, there's just one kind of diagnostic thing we wanted you to know. And that's the difference between primary or essential hypertension and secondary hypertension. And actually 90% of people have what we call primary hypertension. That is hypertension that is not secondary to any particular disease process. There might be a genetic component. We're not entirely clear why some people develop it over others, but it is a disease that isn't curable. It's manageable, but it is not curable. Secondary hypertension is when you get high blood pressure secondary to something else. And that's a much lower number of people with hypertension. 10% of those with hypertension have secondary hypertension. And this can be from blood vessel disorders, coarctation of the aorta, which is when the aorta gets very narrow and causes high blood pressure. Or something called fibromuscular dysplasia, where some of your arteries kind of get this beaded appearance and cause high blood pressure. Different endocrine disorders, when your steroid levels are off or your thyroid levels are off, or your catecholamine levels are off, which are different signalers in your blood that can cause high blood pressure. All those are secondary causes, and these are often, not always, but are often curable. Whereas those with essential hypertension or primary hypertension, they just have high blood pressure. And it's just what they diagnostically have, what they've developed, and it's manageable but isn't curable. There's nothing to necessarily reverse it, like there is for secondary hypertension. All right, so given how many millions of people, right, we said tens of millions of people in the United States, almost a billion worldwide, all have high blood pressure, who should be getting screened, right? Because high blood pressure, we're going to get into this, is known as a silent killer. You don't really get symptoms until it's extremely advanced and your organs are starting to be affected by it. So how do you know you have high blood pressure? Well, you get screened for it. And who should get screened has been studied over time. And this is from the U.S. Department of Health and Human Services. It is consistent with the USPSTF, United States, oh boy, now we're going to blank on this. Someone let us know. USPSTF, they develop a lot. Oh, perfect, it's down here. United States Preventative Services Task Force, USPSTF. They develop a lot of kind of the guideline recommendations on screening for diseases, whether that's colonoscopies, high blood pressure, diabetes, breast cancer, etc. But they recommend that you get screened for high blood pressure in any adult aged 18 years or older who don't have a history of known high blood pressure, which makes sense because if you already have high blood pressure, you don't need to be screened for it. And then that's just a one-time screening. And then anybody who is 40 years or older should get screened for it every single year. And in addition to that, those who are at higher risk for high blood pressure, smokers, people with diabetes, people who are obese, should get screened for it yearly. So it'll be interesting. We'd love to hear from you if you fall in any of these categories, whether you have or have not had screening for high blood pressure. Because anybody who is greater than 18 years old should have a one-time screening for high blood pressure. That's where you go to the clinic, they take your blood pressure, and they see if it's high. People who are greater than 40 years old should have yearly screenings. Every single year you should be screened for high blood pressure at the clinic. And then anybody who is greater than 18 years old with risk factors, smoking, obesity, diabetes, etc., should be screened every single year for high blood pressure. And the reason that we're so aggressive with our screening recommendations is because of this idea that hypertension is a silent killer. And the reason it's a silent killer is because symptoms don't start until it's progressed to severe disease. And it can damage almost every single organ in your body. So you might be walking around with high blood pressure for years and never even know it. But what's happening to your body is seeing damage from that high blood pressure, right? When that blood pressure is high, it stresses your heart, it stresses your kidneys, it stresses your brain, and all this can cause damage. And your organs can compensate and cope with this damage for a period of time so that you'll never even know that that damage is happening until they can't anymore. And when they can't anymore, then you will start to experience symptoms. But all of that could have been prevented if you were screened, detected, and managed your high blood pressure to start with. And that's why they call it a silent killer, because you don't often know you have it if you're not getting screened for it until you already are sustaining organ damage from it. And it increases risk for a ton of stuff. It increases risk for heart attacks, heart failures, strokes, kidney disease, aneurysms, and many more things. It's linked to a number of deaths from chronic disease. And that's why, again, it's this silent killer. Because by the time you know you have it, if you're not getting screened for it, you're already seeing heart damage and kidney damage and brain damage from it. And at that point, you can try to reverse that damage by really aggressively managing your blood pressure, but sometimes the damage is already done and there's no reversing it, which is why we want people to get screened early anyone greater than 18 years old gets screened one time, anyone greater than 40 years old gets screened every year, and anyone greater than 18 years old with risk factors also gets screened every year. Because if you intervene early and you treat it or manage it, whether that be with medication or the things we're going to talk about, you can prevent all these downstream effects that those with high blood pressure that is not well managed will sustain over time. So what exactly is high blood pressure? This is the JNC8. This is an organization that meets every once in a while and kind of establishes and goes through the newest blood pressure literature, evidence, and kind of establishes guidelines. And this particular definition was just published by the AJMC. We believe it might be the American Journal of Managed Care. It might be Association, but this is the AJMC. We'll link it in the video description. And they laid out the JNC8 definitions for high blood pressure. And they said in patients 60 years or older who do not have diabetes or chronic kidney disease, the goal blood pressure level is to be lower than 150/90. And these two numbers here, as we talked about in that video we put out a couple years ago, the 150 is known as the systolic blood pressure, and the 90 is known as the diastolic blood pressure. And those of you who have had your blood pressure taken, you might notice this. They put that cuff, right? They put that cuff around your arm, and there's a tube going to the cuff, and they inflate the cuff with air. And then there's machines that do it now, but in the olden days, you'd have your arm here, there's your fingers. Great, I'm still an excellent drawer. They used to put their stethoscope, right? They used to put their stethoscope and listen. And they listen for two different sounds. And the first sound they hear is the systolic blood pressure, and it's literally a manometer. So there's a dial, and it has different millimeters of mercury pressures. There's 50 millimeters mercury, 100 millimeters mercury, 200 millimeters mercury, and there's a little arrow, and you're pumping up the pressure, and the arrow is going to higher and higher pressures. Then you release that pressure, watch the arrow go down, and when you hear what you're looking for, it might be right here. And you'll say, oh, that's 80. So that's a diastolic blood pressure of 80. So it's in millimeters of mercury, systolic over diastolic, less than 150 millimeters of mercury, and less than 90 millimeters of mercury for those greater than 60 years old who do not have diabetes and do not have chronic kidney disease. In people 18 to 59 years of age without major comorbidities, and in patients 60 years or older who have diabetes or chronic kidney disease or both conditions, the goal blood pressure is less than 140/90. 140 systolic, 90 diastolic. So those are your targets, and keep those numbers in mind because we're going to talk about the 5 things that can help control high blood pressure that are not medications. This is not a knock on medications. As a physician, we prescribe many blood pressure medications. Some people need those medications, and those medications are indicated for a lot of patients. But here are 5 strategies that you can try to employ to, 1, prevent your blood pressure from getting to be hypertension if you are at high risk, or 2, if you have some hypertension, to reduce your blood pressure. Maybe even if you're on medications for high blood pressure, you can use these strategies to try to come off those medications if that's something you're interested in. And the chart we're going to show you right now is a chart that's put out by the American Family Physician, the AFP, and it's non-pharmacologic strategies for managing hypertension. And these are the 5 key recommendations that they have. And it might be kind of small, so we'll read them out loud. So number 1, and we're going to go through each one as well in more detail. Number 1, maintain normal body weight. That's a BMI of less than 25. And they say that if you do that, the studies would suggest that you can decrease your systolic blood pressure by 5 to 20 millimeters of mercury. Right? So we said that most people are targeting 140/90, and the 140 is systolic. And the American Family Physicians, and a lot of people have these 5 things. A lot of different organizations and associations have these same 5 things. This one just happens to be one that we took from the AFP. But if you maintain a normal body weight, you can reduce your blood pressure, the systolic blood pressure, by 5 to 20 millimeters of mercury. So if your target's 140, and let's say you're at 150 millimeters of mercury is your systolic blood pressure, losing weight and maintaining a normal body mass index could decrease that systolic to 150/90, which might then make you not hypertension anymore, right? Because you are less than the 140 goal. Number 2, eating a diet high in fruits and vegetables and low in fat. And we're going to get into that in more detail. That can decrease your systolic blood pressure by 8 to 14 millimeters of mercury. Consuming less than 2.4 grams of sodium per day can decrease that blood pressure 2 to 8 millimeters of mercury. 30 minutes of aerobic activity at least 4 days a week can decrease it by 4 to 9 millimeters of mercury. And then men, no more than 2 alcoholic drinks per day, and women, no more than 1 alcoholic drink per day. And there's more details on this that we're going to talk about here shortly. 2 to 4 millimeters of mercury. So you can see if you employed a few of these strategies, there's a chance you could decrease your blood pressure by, 20 to 30 millimeters of mercury. You potentially could. It doesn't work perfect for everyone, but if you employed a few of these, you lose weight, you eat this special diet, which we'll talk about, consume less than 2.4 grams of sodium, and do some exercise, you might be able to drop your blood pressure 20 to 30 millimeters of mercury, and that very well could lead to you being able to come off medications or not have to start medications. So what about the weight loss? This is actually the most effective way to bring down elevated blood pressure is weight loss, targeting that body mass index, that BMI of less than 25. Because the reductions that some people see can be as high as 20 millimeters of mercury. Again, that could take you from 160 millimeters of mercury for your systolic blood pressure down to 140 millimeters of mercury. That's a huge jump. And when they study this more closely, they have actually found that in some studies, every 2 pounds you lose can decrease your blood pressure by 1 millimeter of mercury. So let's just even say that you lose, I don't know, choose whatever you want. You lose 20 pounds. So 20 pounds divided by 2 equals 10. That could decrease your blood pressure by 10 millimeters of mercury, right? That 1 millimeter mercury for every 2 pounds lost. And that can make a huge difference. So weight loss in those who have BMIs greater than 25 is the most effective approach to managing hypertension or bringing down that blood pressure, or preventing it from getting higher. Similarly, there's also a diet that has been shown to, and this is independent of weight loss, but there's a diet that has been shown to decrease blood pressure, and it's called the DASH diet. And it stands for, we wrote it down here, Dietary Approaches to Stop Hypertension. And it's a diet that's been studied a fair amount, and it's DASH, or DASH. And it's been shown, again, independent of weight loss, to decrease blood pressure by as much as 8 to 10 millimeters of mercury, right? Where we said the goal blood pressure is less than 140 over 90 for most people. If your blood pressure is 150 over 90, this DASH diet could potentially decrease it to 135 over 90. Again, no longer hypertensive then. And this is a graphic. We liked this graphic. It just came from this Division of Agriculture Research and Extension at the University of Arkansas for whatever that's worth. It's a great graphic, though. We appreciate them. We'll link it in the video description. It's their work. But what the DASH diet is, it's a diet, and if we scroll up and show you here, right, it's a diet that is high in fruits and vegetables and low in fat. So the way it breaks down is it breaks down a couple ways. There's things that they want you to eat more of, right? So that color's not going to work. Let's try green. Vegetables, fruits, and then there's things they want you to eat less of. Sweets, fats and oils, actually meats as well. So what the DASH diet says is every day, 4 to 5 servings of vegetables, 4 to 5 servings of fruits, and then 2 to 3 servings of fat-free or low-fat dairy. And that's key because this is a low-fat diet. So it's high fruit, high vegetables, low fat. And it doesn't say don't have dairy, it just says have low-fat dairy. They also like grains, 6 to 8 servings of whole grains. That's important. They recommend in the DASH diet whole grains rather than, refined grains. And they say you can have nuts, seeds, and legumes, but just 4 to 5 servings per week of those, and then less than 6 servings of meat, poultry, or fish. All right. per day, less than 5 servings of sweets per week, and then 2 to 3 servings per day of fats and oils. So again, it is a low fat, high vegetable, high fruit, high whole grain diet. And that alone can decrease your blood pressure. And for more info on that, literally, if you just Google DASH diet, there's a ton of stuff out there that can set up meals and recommend meals and tell you things to stay away from, etc., etc. Independent of weight loss and DASH diet, actually decreasing your sodium intake in and of itself can decrease your blood pressure. So this is a nice salt shaker that we tried to draw naturally, and then this is our person with their bad haircut. The average American consumes, and this is probably not surprising to anyone, but consumes about 3.4 grams of sodium per day on average. Many consume even more than that, right? And the studies say that if you decrease that intake to 2 to 4, less than 2 to 4 grams per day, you can decrease your blood pressure by 2 to 8 millimeters of mercury. So on the high end, we'll just stick with the high end. So on the high end so far, we have weight loss to a BMI of less than 25 can decrease your blood pressure by 20 millimeters of mercury. We have DASH diet, which can decrease your blood pressure by 10 millimeters of mercury. And then we have just decrease your sodium, Na is the abbreviation for sodium, decrease your sodium consumption to 2 to 4 grams per day. And that can decrease your blood pressure by another 8. Right? So far we have a decrease of 38 millimeters of mercury. And again, it doesn't always work perfectly additive like this for people, but the point is that a lot of these lifestyle, diet, weight loss, exercise interventions can have a significant effect on lowering your blood pressure. The last two are aerobic exercise, probably not surprising to anyone. And what they actually studied was about 30 minutes of aerobic exercise, just 4 days a week. So this isn't 3 hours every single day a week. This is 30 minutes of aerobic exercise. So that's kind of cardio, that's not weightlifting, but it could be walking, briskly, jogging, doing cardio classes. 30 minutes of aerobic exercise 4 days a week can decrease your blood pressure by about 4. And then decreasing alcohol intake. This is a little, it's one people talk about a lot, but the studies they did actually looked at people who were drinking as many as 6 drinks per day and found that if they decreased their intake by 67%, which equated to less than 2 drinks per day per men and less than 1 drink per day per women, that could decrease your blood pressure by as much as, it has it up here, 4 millimeters of mercury. And we'll write that in. We forgot to write it. Decreased by 4 millimeters of mercury as well. But if you're not drinking, 6 drinks per day, and you only drink 2 drinks per day, the studies that they did didn't necessarily apply to you. But if you do consume a fair amount of alcohol every day, decreasing that alcohol intake can decrease your blood pressure as well. So if we were to summarize and write it out again, we had weight loss, right? Weight loss was the most effective means, 25 BMI of 25, and that can decrease your blood pressure by 20 millimeters of mercury on the high end, and about 1 millimeter of mercury decrease for every 2 pounds lost. After that, the DASH diet in and of itself, right, high fruit, high vegetable, low fat, can decrease your blood pressure by as much as 10 millimeters of mercury. Keeping your sodium, Na, sodium intake to less than 2.4 grams per day can decrease your blood pressure by as much as 8 millimeters of mercury. Aerobic exercise, 30 minutes, just 4 times per week, not a huge amount, can decrease by 4 millimeters of mercury. And if you do drink a lot, drinking less can also decrease your blood pressure. But this is about decrease of 42 millimeters of mercury. Again, doesn't always work this way, but for some people it does. But you can get a fair amount of additive effect. You can really, for those who may be overweight, eating a lot of salt, a high-fat diet, who don't exercise, implementing a lot of these things, or even a few of these things, can have a profound effect on decreasing your blood pressure or preventing your blood pressure from getting high. So hopefully this was helpful. Hopefully this was interesting. This is our strategies on decreasing blood pressure, not using medications. Not that it's a knock against medications. Again, we prescribe them. Some people really do need them. Hypertension is a silent killer. You do not know it is hurting your body until sometimes it has already had drastic effects on your body. So get screened. Initiate some of these lifestyle things. Make sure you're staying on top of your blood pressure, and you will be grateful for that 15 years from now, maybe even less, depending on how uncontrolled your blood pressure is. Hope that's helpful. Let us know what thoughts, comments, questions you have down below. Even just comment, say hello. Check out our other videos. Check out our page. Subscribe. Hit the bell button. Check out our Patreon page if you're interested. We'd love to have you join us. And with no further ado, stay well, keep learning, and we will see you all next time.